you know that heart disease is the #1 killer of women? I didn't, until it happened to me.
All women need to know that cardiovascular disease is the #1 killer of women. Know your family history and talk to your doctor about heart disease.
Awareness may make the difference between life and death.
Good evening and welcome this evening. We're so happy you've joined us for Moms Matter, a program and a conversation about maternal and cardiac health. I want to begin by saying Happy Heart Month. It's February 1st. I also want to say and acknowledge that it is Black History Month. And I want to wish everyone a happy Chinese New Year. With everything that's going on right now, we are so grateful that you've chosen to join us this evening. And we're thrilled to be tackling this topic. I want to begin by saying thank you to our sponsors, CVS Health, our Live Fierce Take Action sponsor, White Plains Hospital, our Live Fierce Go Red sponsor, Northwell Health, and of course, our other Go Red sponsors here in Westchester, including Morgan Stanley. With that, I'd like to introduce our esteemed panelists and moderator this evening. First, we are joined by Jennifer Bello, our Westchester Go Red for Women co-chair and Senior Director of Nursing at White Plains Hospital. We're also joined by Dr. Ewan, a cardiologist from Scarsdale Medical Group and White Plains Hospital. And finally, Dr. Prasad, Director of Curriculum and Education and Assistant Professor in the Division of Maternal Fetal Medicine within the Department of Obstetrics and Gynecology at New York Medical College, as well as Westchester Medical Center. We will begin by bringing them on camera, and I will pass it over to them for a dialogue. Please feel free to ask your questions in the chat. We will be answering those and have reserved time at the end to make sure that you are able to interact and enjoy. So with that, I will hand things over to Jennifer Bello.
Thanks, Megan, and welcome everyone tonight. Thank you, Dr. Ewan and Dr. Prasad, for joining us this evening. I'm excited to get into our conversation, and as was stated in the video, just to bring awareness to what's something that may actually make a difference and save a life. Dr. Prasad, just wanted to ask in terms of why is it so important for women to safeguard their health before pregnancy?
Very important to safeguard a woman's health prior to pregnancy, because we know that women with underlying disease are at increased risk for poor pregnancy outcomes. It's also important to realize that maternal health conditions can worsen with pregnancy, and that in itself can result in poor maternal outcomes. So you consider the preeclampsia period, the time that's before a patient gets pregnant. It provides a unique time frame in which women can meet with their doctors, whether it's a primary care physician or an obstetrician gynecologist. They can review their risks, determine which ones are modifiable, and we can make recommendations to decrease those risks. It's also a good opportunity to have discussions with your doctors about potentially lifestyle modifications that promote good health. It could be something as simple as changing your diet or having a regular exercise regimen. Dr. Ewan, do you have anything else that you would want to add on?
First of all, I'm honored to be co-chairing this with you. I am excited about this session and also extremely excited about the initiative that the Biden and Harris administration had started as the White House Day of Action on Maternal Health in December. Being general cardiologist, it is so important for me to be able to help my patients, especially women who are considering conception, in modifying their risk factors from high blood pressure, diabetes, insulin resistance, weight loss, etc. And having a good preconception health is key into the entire couple trimesters and into the future. And onto aging and facing menopausal issues.
Dr. Ewan, just to note some of the pre-conception numbers, I know we did a series a few months ago, just in terms of knowing your numbers. What advice would you give for women before becoming pregnant in terms of numbers that they should be looking at?
So basically, we start with the blood pressure. 120/80 is considered an optimal blood pressure The American Heart Association and the American College of Cardiology had recently published a paper in terms of stage 1 hypertension, which a lot of women and young people do live at. And that is 130 to 139 systolic and a diastolic of 80 to 89. That is the red flag for us, and especially in women who are on birth control, who may have PCOS, which is polycystic ovarian disease. These are truly modifiable risk factors with changing in diet, going into a more plant-based, low-fat, low-refined carbs diet. The other arm that we look at too is also insulin resistance, hyperglycemia, aiming for an A1C preferably less than 5.8. And also cholesterol. Total cholesterol is an overall number. We need to look at the breakdown between the HDL cholesterol and the LDL cholesterol.
Thank you, Dr. Ewan. Dr. Prasad, what is your advice, or what is the role that high blood pressure plays during a woman's pregnancy?
Is a really dynamic state, and there are a lot of physiological changes that occurs in pregnancy that are known to cause a lot of stress on the cardiovascular system. And one of the changes that we see are changes in blood pressure. So while some women are able to adapt, others may develop elevated blood pressures in their pregnancies. And we know that when that happens, it can be associated with poor outcomes. One of the most concerning conditions I tell all of my patients about is a condition known as preeclampsia. It's when you have elevated blood pressures that's associated also with organ damage. The condition places the mom and baby at risk, not only during the pregnancy, but in the lifetime. Women who have preeclampsia have an increased risk of developing cardiovascular disease. It's well established in the literature. And this risk can be as high as 3 times that of a woman without that condition. I think that managing blood pressures is very important, and it needs to start even before conception. And Dr. Ewan actually drove home that point.
Thank you. So I know a lot of people listening may think, I'm not at risk. That's a common theme, especially that we as women, as mothers, tend to think. What are some potential risk factors that mothers may face?
Risk factors that we look at when we're evaluating our patients, and some of them are just inherent and some of them are modifiable. One thing that I look at right off the bat is the age of my patient. We know that we have an aging, population. More women are getting pregnant, over the age of 35, and that's just a matter of a lot of women taking on more professional responsibilities. We know that age over 35 or even age over 40 increases the risk for cardiovascular disease, and that can be much as 30 times that of a younger counterpart. So that's one thing I look at. Another thing is I look at the race of my patient. We know historically that women of color bear a higher burden of disease, whether it's cardiovascular disease or not. And sometimes we can say it's secondary to genetics, but we have to also consider other key factors, things that may be differences that are in the quality of the care that this patient's getting. What are their resources? We know that sometimes under-resourced communities are more likely to have higher risk pregnancies. So that's definitely something that I consider. The last thing I look at is their BMI. We know that women with increasing BMI are at increased risk for adverse pregnancy outcomes. And women that are morbidly obese are at 3 times the risk of pregnancy-related death. And this is, a really important factor to consider because it's an easy, and the lifetime risk associated with obesity and long-term cardiovascular disease is well established in the literature as well. So these are the things I look at when I look at my patients. I don't know if Dr. Ewan has any other factors that she considers.
Depending on the age of the patient, there is a risk calculator called the ASCVD risk calculator, which is available everywhere. It's important for all of our preconception patients to go over this risk calculator with their primary care provider, aiming at an optimal LDL, also aiming at lifestyle changes, and that also includes the calculation with blood pressure. So blood pressure is really the key to start out with, and also nutrition as well. What kind of diet do you recommend, Dr. Prasad?
had explained it quite accurately before. It's low fat, high veggie diet. It's typically what we would recommend as well.
We also know that the role of lactation and breastfeeding has been shown to reduce risk of future cardiovascular disease. Dr. Prasad, what are your thoughts?
Yeah. So, every mother has a right to choose to breastfeed, and we know that breastfeeding has many, many benefits. And that's well supported by the literature. Children who are breastfed have a decreased risk for things like sudden infant death syndrome, childhood infections, childhood obesity, and even GI complications. What we fail to mention to our patients, though, is that breastfeeding has a lot of benefits for moms as well. It reduces the risk for obesity, hypertension, high cholesterol, diabetes, cardiovascular disease, and even certain types of cancer, like breast cancer and ovarian cancer. So I always encourage my moms to attempt to breastfeed. Our goal is to get our moms to breastfeed or feed breast milk to their children exclusively for at least 6 months if possible. And, with our assistance, we can really get you there.
Thanks, Dr. Prasad. And it's so important to say in terms of just trying as best you can, but we know that it can add stress onto a new mom's life. So having that partnership with our providers and our care team is something that really helps us in that journey. And to know the possible benefits of that in the long run really is helpful. In terms of long-term health, and when we look at the overall effect that a woman's pregnancy can do postpartum as they approach menopausal years, and I think Dr. Ewan, you touched upon it, where the White House now is approving, postpartum up to a year of covered medical health. I guess really the question is, what is the push behind that, and why is it so important for postpartum women to really check in with their providers?
Yes, so the number one killer for women in this country is not breast cancer, ovarian cancer, it's really cardiovascular diseases. A lot of times the gynecologist and the obstetric department has really become the gatekeeper, funneling the postpartum women back to the primary care physician in order to continue managing the blood pressure, especially if women have developed gestational diabetes and also pregnancy-related hypertension. Going forward, weight loss in an appropriate manner and time is important. And as the women begin to go back to their normal body size, controlling that blood pressure, the LDL cholesterol is very important, because studies have shown that preeclampsia, pregnancy-related hypertension, gestational diabetes is a predictor of future events as the women age, especially stepping into the menopausal years. As we lose our estrogen, as our LDL and our blood pressure start climbing and approach that of like a man.
Dr. Prasad, we've heard some information about the fourth trimester and how important that can be in terms of the predictability postpartum as well. What are your thoughts on?
Yeah, so, postpartum care is very, very important. And we describe the period after delivery as the fourth trimester. It's the weeks and months after you have your baby. And it's a challenging period where moms have to balance the care of a newborn and self-care. But we all know it's critical, and it sets the stage for long-term health. So any woman who develops any type of condition in pregnancy or has chronic illness such as chronic hypertension, diabetes, or obesity, it's really, really important for them to follow up with their OBGYN so that they can optimize their management, so that they can transition their care to a lifetime care provider, whether it's a primary care physician or advanced practitioner. The visit is really important for multiple different reasons, and Dr. Yuan touched upon this. It's our way to reassess your blood pressure, because in the weeks that follow the delivery, we tend to see increases in blood pressure. It also is a way for us to evaluate for any types of signs and symptoms for things like strokes. 50% of these events occur within 10 days of being discharged from the hospital. And when it comes to diabetes, it is a pregnancy-related condition. We do call it gestational diabetes, but there's a subset of the population that ends up having occult diabetes in the weeks to follow. So it's really important for us to screen you once again to make sure that you have resolved this condition. Also, view the course of the pregnancy. In some cases, unfortunately, some moms do experience pregnancy loss, and it's our way to circle back and determine what were the risk factors that resulted in that particular outcome, and maybe even make life modifications that can help prevent associated cardiovascular disease that can be seen with pregnancy loss as well. So, it's really important for us, and I try to emphasize that our patients should come back and see us at least one time in the postpartum period. I think it's amazing that they're going to be considering extending this period for up to 1 year after delivery. I think that's crucial. But just to emphasize that it is important for moms to visit us. And unfortunately, as many as 40% of moms don't make it to their postpartum visit. But I cannot emphasize how much and how important this is for the long run.
Great. Dr. Ewan, what can all women learn from the health journey that mothers face during pregnancy?
Again, basic lifestyle changes, activity. The American Heart Association has recommended 150 minutes of activity. Dr. Prasad, for a pregnant woman with normal blood pressure, what do you recommend in terms of activity? The guideline I just propose is for people men and women who are not in the gestational time.
We do acknowledge that exercise is really important in pregnancy itself. And I do encourage my patients to partake in exercise. I just caution them in terms of aerobic exercises or exercise that may result in inadvertent trauma to the abdomen. So those are things that I would, have my patients be wary of. But otherwise, it's well encouraged.
And I think, Dr. Prasad, you touched upon importance of following up even after delivering with your OBGYN, at least as a first basis, and then really trying to connect with a primary care physician or a cardiologist like Dr. Ewan. Do you find that, mothers tend to stick with their OBGYN, or are they more likely then to follow up with a cardiologist once you've referred them?
One thing I love about my field is the rapport I build with my patients. And, one thing I can tell you is that they tend to come back to us because we've built that level of trust. But at the same time, I encourage them that it's a good idea to establish care with a primary care provider because they can provide a full scope type of care for them. Unfortunately, I only provide obstetrical services and care. So it's better to have someone else with the expertise or general health to take on that as well.
Dr. Ewan, do you see a lot of postpartum moms, and how do you balance, building that relationship after they've had that, trusting relationship with their OBGYN?
I haven't seen a lot of postpartum moms, but I do have a lot of women who self-referred because of family history. And also the difficulty in controlling the blood pressure and their weight postpartum.
So Dr. Ewan and Dr. Prasad, thank you so much for diving into this topic. There clearly is an urgent need, which the White House is backing in terms of devoting resources to maternal cardiovascular health. I think we all understand how important our moms are, or our matriarchal figure, whether they're directly our mom by blood or just a family connection. And this is such a priority for Go Red for Women. And that's why we're asking those who have joined tonight to take a moment and make a gift to the Go Red for Women movement to help save women's lives. So if you're able to, find your cell phone and text Go Red 914. It's also up on the screen to the number 41444. Again, it's GORED 914 to 41444, and make a gift. With maternal mortality rates rising over the past 3 decades in the United States, every facet of maternal health must improve. We know how important our moms are. We know how important they are to our family and to keeping our connections alive. The American Heart Association is providing scientific guidance and proven strategies to reduce overall deaths and address racial disparities in maternal health. Your gifts supporting the American Heart Association work to ensure healthy pregnancies, healthy births, and healthy moms. Your donation ensures mothers will be healthy and present for their children for years to come. And we know how important our moms are in our lives. Again, please text Go Red 914 to 414444. And we're going to open the event up if anyone who's listening has any questions for our panelists, Dr. Prasad and Dr. Ewan. Just you can type it in the chat and then we can read your questions online. For Dr. Prasad, 50% of events will happen 10 days from discharge. What are some of these events that you see?
That we can potentially see include strokes. And this is seen in a subset of individuals that may have conditions such as hypertensive disorders of pregnancy. The one that I mentioned was preeclampsia. That's why it's really, really important for us to follow up with our patients at a very close interval, especially when they have certain types of conditions in the postpartum period. I generally bring back my patients within 1 week of delivery if they have some sort of a complication like preeclampsia, just to provide a safeguard. If I find that they need to be reevaluated, even in the subsequent weeks, I'll bring them back sooner than that.
Excellent. And Dr. Prasad, what are some of those symptoms that a new mom may be brushing off as I'm just tired and exhausted from having this new baby?
Yeah, it's a real challenge, and it's really hard to distinguish between the normal postpartum woes versus something that may be a little bit more complex and complicated. With preeclampsia, it's one of those things that are associated with persistent headaches. It can be associated with visual changes, abdominal pain, excessive swelling. So those are things I tell my moms to be wary of, and obviously to give us a call about. Some women are also at increased risk for deep vein thrombosis that can increase the risk for potential strokes. And so if they find that one leg is a little bit bigger than the other or looks a little bit red or uncomfortable, it's always better to be safe than sorry. Always call us. We are always available to you, and we will address your concerns.
Another panelist has a question. In terms of, on average, how many calories should a healthy pregnant woman look to burn when working out?
I don't think that I have that number off the top of my head. I would have to get back to you. I do encourage, exercise, but not necessarily, aerobic exercise that would result in excessive calorie burning. But it's a good question. I would have to get back to you on what that.
Thanks, Dr. Prasad. Dr. Ewan, someone said a friend of theirs has been diagnosed with postpartum cardiomyopathy, and they're wondering, what is that exactly?
So postpartum cardiomyopathy is weakness of the heart muscle that's developed usually into the second and third trimester. Am I correct, Dr. Prasad?
It's congestive heart failure within 1 month of delivery and up to 5 months postpartum.
Usually in the latter part, and sometimes it could be genetics, and the prognosis is actually quite poor for future pregnancies. We do not recommend future pregnancies. The American Cardiology Board has very strict recommendations of not getting pregnant for certain entities such as cardiomyopathy, aortic stenosis, Marfan syndrome. So these are specific entities that the board has published specific guidelines. I think a third of the women who develop cardiomyopathy peripartum can recover with medications. Currently, we have fancy medications like Entresto, some beta blockers like carvedilol. So these women eventually will hopefully recover, but those who do not recover can have a pretty difficult course. But with new medications, the need for transplant is probably a minimal going forward, unless there's a genetic and a familial representation here.
Thanks, Dr. Ewan. And Dr. Prasad, is there anything when we're talking about, before conceiving, any risk factors that would help you be able to determine whether cardiomyopathy would be developing?
Predict whether or not a patient may potentially go into peripartum cardiomyopathy. There are certain risk factors like Dr. Yuan spoke about, and that can potentially be addressed, but nothing consistently can say can be related to it. We know that women who have a history of peripartum cardiomyopathy are likely to have it in a subsequent pregnancy, which is why we always caution our moms about that condition. And one of the best things that you could potentially do is establish care with your cardiologist, undergo that echocardiogram to determine what your ejection fraction may be, and we can risk stratify you on that information and move forward from there. You know, sometimes women have recovery of their cardiac function, and we follow them very closely over the course of the pregnancy, and they have great outcomes. In patients that have persistent, left ventricular dysfunction, we're a little bit more wary about those patients, and unfortunately, sometimes the pregnancy can result in long-term effects on cardiac function where the patient does not necessarily recover from it and may need, for example, a life vest. So we want to prevent that type of outcome in our patients, and that's why it's really important for individuals, especially those with underlying cardiac disease or maybe a family history of disease, to talk to their primary care doctor, undergo the routine types of screening, and catch conditions like this before they occur in pregnancy itself.
That being said, it's so important to take complaints and take a good history. Women often get very short of breath, especially in the second to third trimester, and a good exam, EKG, blood tests, which we often order, including BNP, and possibly an echocardiogram is very important to catch these diseases, because delivery itself, especially when there's a high amount of blood, high volume, can aggravate congestive heart failure. And also in patients without heart failure would be hypertension and also their sugar load.
Perfect segue to the few more questions, Dr. Ewan. We've got a few questions related to gestational diabetes and diabetes. What's the difference? Are you more at risk of developing diabetes if you suffer from gestational diabetes during pregnancy? And also, why do some people develop gestational diabetes when they're looked to be healthy, pre-pregnancy? We've gotten through a few questions related to those two topics.
Dr. Prasad, I think I'm going to have to send that to you because I'm not an endocrinologist. Sorry about that.
Answer the question. So gestational diabetes is diabetes that occurs in the pregnancy. It's a diagnosis that's made typically at around 28 weeks or so, when we generally screen for that condition. Type 2 diabetes is pregestational diabetes. It's diabetes that has been established as such outside of the pregnancy. The way that diagnosis is made, typically, as many moms out there realize, is that we do something called a glucose challenge test, and that can be done outside of pregnancy and during pregnancy itself. Some individuals may get the diagnosis from a hemoglobin A1C, for example. The difference between the two is basically the timing in which the diagnosis was made. Gestational diabetes can resolve after pregnancy, and in order to determine if that is the case, it's really important in the postpartum period to test for resolution. So we typically give our moms those glucose challenge tests about 6 to 12 weeks in the postpartum period, just to make sure the condition has in itself resolved. I always think about pregnancy as being, a window to a woman's future health. It kind of brings out those underlying conditions that we may have a predisposition to. So women that have gestational diabetes, I can say about 50 to 80% of those women who do not take risk-reducing measures, who do not modify their diet, or may not exercise on a regular basis, about 50 to 80, very, very large component, percentage, do end up with type 2 diabetes later in life. So it's really, really important to get those, risks under control, to one, maybe delay the diagnosis, or maybe end up not even succumbing to that condition at all.
As a cardiologist, type 2 diabetes is one of our top risk factors for developing cardiovascular complications, such as blockages in the heart, in the arteries of the heart, blockages in the legs, and leading to strokes. So for us, as you say, pregnancy is a window to our future health, and having that postpartum care is very important.
One of our other visitors wants to know, how important is blood pressure control when a woman is trying to become pregnant?
Blood pressure control is important in all stages of life, and the guideline of 120 over 80 is very important. That number has actually been lowered from 130 over 90 to 120 over 80. So really at all ages, we aim to have a blood pressure of 120 over 80.
So much of this focus on pre, during, and postpartum, as moms age and they start to enter menopause, how does their risk of cardiovascular disease change? Should women be seeing a cardiologist during menopause as opposed to just regular primary care follow-up? What do you suggest would be the best course of action?
As a woman ages into the fourth decade and fifth decade, it's important for the primary care physician to continue monitoring blood pressure, BMI, LDL cholesterol, and A1C. With a good general internal medicine exam, all these measures will be kept track. Of course, women with family history and especially prior history of pregnancy-related hypertension should really also seek additional cardiac consultation, especially if the LDL is high. There are very fancy, easy, user-friendly cardiac testing, such as the coronary calcium score, that can really risk stratify women to see whether they need statin medication as they age. And unfortunately, as we lose our estrogen into our menopausal years in the fourth and fifth decade, that LDL does rise, the blood pressure does rise, and that's considered essential hypertension. So when that LDL rises and the blood pressure rise, our risk factors really approximate to that of men, pretty much age match in that age group. And that being said, it's even more important for women to seek primary care attention postpartum and so forth. Bone health is also very important. There's a lot of data about not taking too many calcium supplements because it can cause calcification of our coronary arteries. So that's a very important question, especially women who've had multiple courses of fertility drug, and that's something Dr. Prasad can comment on, whether extra hormonal treatment can affect bone health. So as a cardiologist, we look at the full picture from diabetes, hypertension, waist size, exercise, and bone health as well.
Dr. Prasad, in terms of Dr. Ewan, what risks are our patients at if they have had a lot of like hormonal treatments to try to conceive and different modalities?
It really depends on the regimen that's being used. So I think that's a question that would be, specific depending on what kind of management was undertaken. We know that some women that may end up, using other medications over the course of their pregnancies, for example, chronic steroids and whatnot, can result in an increased risk for cardiovascular disease, hypertensive disorders of pregnancy, and even osteoporosis. So it really depends on the patient history. And for me to give you, an accurate assessment on that, I would have to know the details of that particular case.
I think that that's important takeaway in terms of when you're meeting with your doctor or your primary care doctor to include all of this in your history too, in terms of, what took to conceive, where are you after conceiving, and any medications that you're on is so very important. We're beginning to wrap up the program. I guess in terms of, American Heart and all the focus that we have on, health before, during, and after pregnancy, what would be the 3 takeaways that you'd want everyone who's listening today to take away from this program and start to do tomorrow? We wanted to start maybe with Dr. Prasad.
Sure. One of the best things that you can do for yourself is make your health a priority. Go see your primary care doctor and talk about your risk factors and see what you can do to modify your risk for long-term adverse outcomes. When you do get pregnant, establish your care early. That way we can do the reassessment of your risk factors. We can provide recommendations early on to improve the outcome of the pregnancy itself. And number 3, I'm emphasizing this, come see us again in the postpartum period. I know a lot of moms are excited to be home with their babies, but we want to make sure that you're doing well as well. And we want to make sure that you have taken care of yourself. So come please see us.
Dr. Ewan, what would be your 3 takeaways?
Modify stress. In the COVID era, going into our 3rd year, stress is a big item, whether it's professional stress, home stress. We all need a way to deal with our stress. So whether it's a cup of decaffeinated tea, whether it's a walk, it's important for us to know how to manage our stress. That being said, incorporating exercise 150 minutes per week is very important. And as Dr. Prasad said, be in touch with your primary care, attend these seminars, go on the American Heart Association website. There's so many links, so many fun things to discover. I always tell my patients to get on the link because there are recipes, there are suggestions, and it's a wonderful, wonderful organization. And also your community, having a walk with a girlfriend and really establish goals to keep your weight in check and keep your blood pressure in check is very important.
Well, thank you, Dr. Prasad and Dr. Ewan, for your time today. This was such a meaningful and educational conversation. We want to make sure that everyone who's listening takes away the importance of taking time for yourself, listening to your symptoms, really, putting mom first for once, which we know definitely does not happen. And everyone can say that we do, but we know we always put our needs to the bottom of the list. It's so important so that we can be there for our children and for future generations. Again, if you're listening, please text Go Red 914 to 41444 to help us continue to raise money and awareness for research, again, to keep our moms healthy. As well as we're kicking off, this is Heart Month, grab a friend, make an appointment to see their primary care doctor, to see your OBGYN doctor, make it a fun day, make it a lunch date. It's so important that we look out for each other as moms and as women, and raise awareness, because like the video in the beginning said, awareness can make a difference. And if we could save one life, we've done the right thing. Again, Dr. Ewan, Dr. Prasad, thank you so much for tonight. And it's been great. Please make sure, again, going with the theme, reclaim your rhythm. This is the year. This is the year to get our life back as COVID's starting to slow down and really de-stress. So thank you again and have a great night.